Hi, I'm Dr. Bob DuVall, the Program Director at Sports Medicine of Atlanta for their Orthopedic Manual Therapy Fellowship Program and the Orthopedic Residency Program. Our Orthopedic Manual Fellowship Program is accredited by the APTA. And of course, our focus is on manual therapy and manipulation. And what comes to mind right away is ergonomics. I'm today here at Oakworks to illustrate some equipment to show some of the ergonomic features that are very helpful for orthopedic manual therapy. Let me first start with this ergonomically designed saddle stool. This stool, as you can see, is asymmetric and designed for comfort for the operator. And I'm privileged to have the opportunity to use that with this PT 300 electric high-low table, which has a very unique feature that we're going to take a look at, which is this dropout feature for the actual end of the table. To a manual therapist working on the cervical spine, this becomes very unique and valuable for different testing about the cervical spine, particularly for the vertebral artery testing. If we don't want the patient's head to be beyond the end of the table, we could conveniently administer the test, and then reposition this dropout feature so that if the patient were to experience syncope or vertigo or any other neurologic findings associated with a positive vertebral artery test, we have the convenience of repositioning the patient very comfortably back into this position. So let me demonstrate and illustrate this for you. Brennan, do you mind joining me, please? If you would, lie on your back, head down here. I'd like your head to be to the very end of the table. Right there, right there, perfect. Now relax and be comfortable. I'm now going to elevate the table to my comfort zone, and we're going to administer a vertebral artery test on Brennan. Using this dropout feature, I'll be able to put his head in a position that if he were to experience any neurologic signs, I could conveniently elevate this dropout feature right back. So I'm first going to drop the table end about 45 degrees, which will allow me and permit me enough back bending. So with this, I'm going to back bend, side bend, and rotate. Brennan, look at me in the eyes. And I'm watching his pupils. I'm looking for any neurologic findings as I take him into the extreme position. Likewise, Brennan, tell me if you experience any nausea or any kind of dizziness or any symptoms like that. Just keep looking at me. I'm observing his pupils. They're normal. And I would hold this position for 30 seconds. How are you doing?
Good.
Good, okay, and just stay in this position. This is a test position. Now let's hypothetically say he experiences nausea, or I see some pupil changes, dilation in particular. I could very easily, with my knees, put him right back into position and perhaps even do a little flexion to put him back into the anatomically correct position. This feature, there's no other table that permits us to do this. It's excellent for manual therapy and cervical spine testing. Likewise, in this position, very convenient and accessible, I can test sharp purser, tuck your chin in, right here like this. Let me give you a little back bending to allow that better. And relax, and back up. And again, drop your chin down. And I'm looking for a shearing action of C2 on C1, looking at the sharp purser to check the integrity of the transverse ligament. Likewise, I can look at the alar ligaments with simple side bending and feeling the spinous process of C2 go in the contralateral direction of the side bending. Very conveniently positioned and cervically subcranially screened in a very efficient manner here using the PT 300 Oakworks table.